Majority of women do have swollen hands and feet in pregnancy, and some believe that these swollen hands and feet indicates that the woman is going to have either a twin or a baby boy. Is this really true? Watch this video to the end as I tell you whether it is true or not. Hi, I'm Naki the midwife and welcome to this space. In today's video, I'm going to talk about danger signs in pregnancy. Danger signs are signs that the woman may feel or experience, which could mean that the pregnancy is at risk or there is a complication with the pregnancy. These are signs you need to know so that immediately you feel any of the signs, you report to your health facility immediately so that something can be done. First of all, when there is vaginal bleeding in pregnancy, is this normal? No. In early pregnancy, if a woman is bleeding, it could indicate ectopic or a miscarriage. And in late pregnancy, it can be a sign of either what we call placenta previa or placenta abruptio. What these two conditions are is that, for one, the placenta is not situated at where it should be situated. For example, if the placenta is supposed to be situated here and it moves to this place, then the woman will bleed in this case. And with placenta abruptio, ideally, after delivering the baby, that is when the placenta is supposed to detach. But a woman who has placenta abruptio, the placenta will detach at any time it wants. So, when a woman is bleeding in pregnancy, it's a danger sign. So if you experience any of the signs, make sure that you report to your health facility. Secondly, severe abdominal cramp or pain. Occasionally, a woman may feel an abdominal pain. That is occasionally. But when it becomes severe and more persistent, it's an indication that either you are having an ectopic pregnancy, miscarriage, or even preterm labor. So, severe and persistent abdominal pain is not normal in pregnancy, even though occasionally you may feel a pain once a while. Thirdly, severe headache, blurred vision, or dizziness. This is one complication in pregnancy that needs urgent treatment. Yes, urgent treatment. If you suddenly start having blurred vision, you start feeling dizzy, and then this headache is so severe that you can't control it, it's a sign of what we call preeclampsia. This preeclampsia, if it's not taken care of immediately, it could result in fitting as if you have epilepsy. So this is one complication in pregnancy that we pay so much attention to. So if you are experiencing any form of dizziness, severe headache, or you're having blurred vision, report to your health facility immediately because it is a danger sign. Now, severe nausea and vomiting. We know that nausea and vomiting is normal in pregnancy. Yes, but if it becomes severe, then it means something is going wrong. We call this Hyperemesis Gravitarium. So, ideally, within the first trimester of pregnancy, your nausea and vomiting should cease. Yes, it should. But then, if after 20 weeks, and then you are still vomiting, and it's so severe that it disrupts your daily activities, it is a sign that you are having what we call Hyperemesis Gravitarium. And this, if not attended to, can lead to dehydration, can cause death to the baby, and also let the mother run into shock. You wouldn't want to lose your baby as a result of severe nausea and vomiting. So if you experience this sign, kindly report to the hospital. Again, fluid leaking from the vagina. This is the fluid that protects the child when it's in utero or in your womb. But if this fluid starts leaking before you deliver, it's a sign of preterm labor, or it increases the risk of infection because the fluid is serving as a protection to the child. Now the protection has been taken off, so there will be infection, which will affect the child in the long run. So if you are having fluid leaking from the vagina, make sure you report to the hospital promptly so that they can attend to you. Now, swollen hands and feet. About 80% of women do have this in pregnancy. Have you ever wondered why these women experience this? Swollen hands and feet in medical terms is what we call edema. It could be as a result of three things. The first one, when a woman gets pregnant, there's an increase in blood and fluid volume. When this happens, it leads to the buildup of fluid in either the woman's hands or her feet. So this is one reason why we usually see a woman's hands or feet swollen in pregnancy. Secondly, it could be as a result of excessive weight gain. When you gain so much weight in pregnancy, it leads to fluid retention, hence contributing to these swollen hands and feet. Now, the third and very important one is a sign of preeclampsia. Preeclampsia is when you have high blood pressure in pregnancy, together with what we call proteinuria, which is when your urine is tested and they find protein inside. Ideally, it shouldn't be so. So if you have what we call proteinuria and your blood pressure is also high, it's called preeclampsia. And if this is not attended to promptly, it could lead to what we call eclampsia, which is feeding. So these are the three causes of edema of the hands and feet. If you have any of these signs, it is a danger sign. Don't just sit down and not do anything about it. Report to the hospital quickly so that something can be done about it for you. To the last sign, reduced fetal movement. By 16 weeks of pregnancy, you should start feeling the movement of your baby or the kicks of your baby. But then the frequency and then the intensity vary from woman to woman. If you notice a significant decrease in the movement or the kicks of your child, it's an indication that your baby is either in distress or there's something wrong with the pregnancy. But here is a solution to this particular one. You can do what we call fetal kick count. This is where you count the movement or the kicks of your baby each day. This helps you to know when there is a decrease in the movement of your child, then you know that there is something wrong. In conclusion, make sure you visit your gynecologist, doctor, or healthcare provider if you experience any of these signs, because they are danger signs in pregnancy and can cause harm to either you or your baby. If this video was of any help to you, why not subscribe, recommend to someone, like, and comment on it, and let us also know which topic you want us to treat next. Hope to see you in my next video. But for now, bye.